Types of diabetes mellitus. Medical World Channel. Video by clinician Rovan Birinji. There are two types of diabetes mellitus. These include 1. Type 1 diabetes. In type 1 diabetes, formerly called insulin-dependent diabetes or juvenile-onset diabetes, the body's immune system attacks the insulin-producing cells of the pancreas, and more than 90% of them are permanently destroyed. The pancreas, therefore, produces little or no insulin. Only about 5 to 10% of all people with diabetes have type 1 disease. Most people who have type 1 diabetes develop the disease before age 30, although it can develop later in life. Scientists believe that an environmental factor, possibly a viral infection or a nutritional factor during childhood or early adulthood, causes the immune system to destroy the insulin-producing cells of the pancreas. A genetic predisposition makes some people more susceptible to an environmental factor. 2. Type 2 diabetes. In type 2 diabetes, formerly called non-insulin-dependent diabetes or adult-onset diabetes, the pancreas often continues to produce insulin, sometimes even at higher than normal levels, especially early in the disease. However, the body develops resistance to the effects of insulin, so there is not enough insulin to meet the body's needs. As type 2 diabetes progresses, the insulin-producing ability of the pancreas decreases. Type 2 diabetes was once rare in children and adolescents but has recently become more common. However, it usually begins in people older than 30 and becomes progressively more common with age. About 26% of people older than 65 have type 2 diabetes. People of certain racial and ethnic backgrounds are at increased risk of developing type 2 diabetes. Blacks, Asian Americans, American Indians, and people of Spanish or Latin American ancestry who live in the United States have a twofold to threefold increased risk as compared with whites. Type 2 diabetes also tends to run in families. The main factors for developing type 2 diabetes include: obesity is the chief risk factor for developing type 2 diabetes, and 80 to 90% of people with this disorder are overweight or obese. Because obesity causes insulin resistance, obese people need very large amounts of insulin to maintain normal blood glucose levels. Certain disorders and drugs can affect the way the body uses insulin and can lead to type 2 diabetes. Diabetes also may occur in people with excess production of growth hormone, acromegaly, and in people with certain hormone-secreting tumors. Severe or recurring pancreatitis and other disorders that directly damage the pancreas can lead to diabetes. Please like this video in case it was helpful to you. You can as well subscribe to this channel. Let's build a heal height aware community together.